Good morning. I'm Dr. Jennifer Vines. I'm a family physician and a public health officer for the Multnomah County Health Department. We in public health have been working closely with the Oregon Health Authority and the Department of Environmental Quality to monitor air quality in our region. And as you know, yesterday it was unhealthy for everyone, and today most recently it's considered unhealthy for sensitive groups. So those sensitive groups are young children, the elderly, and people with chronic heart and lung disease. And there's a lot that goes into air pollution, but by far the most concerning component is the small particulates, so the particulate matter 2.5 microns or PM 2.5s. And these are very small particles that can penetrate deep into the lungs. And for a short-term exposure like this, we worry about irritation of the eyes, nose, and throat, and irritation of lungs, especially, again, in young children, the elderly, and people who have conditions like heart disease, asthma, or chronic obstructive lung disease, also known as emphysema. I get a lot of questions about mask use, and there's not a simple recommendation for the public. There are pros and cons, and the masks that are easiest and most comfortable to wear, like a simple surgical mask or a dust mask, will help filter large particles, but they won't do much to keep out the smaller particles that we're most concerned about. You will hear about what are called mask respirators, also known as N95s or N100s. And the goal there is to have a mask that's tight enough to create a really good seal around the face. But when you need to know that you're well protected, usually that seal has to be checked and verified by an expert. So a member of the public just buying one of these masks and putting it on might get some benefit, but they might not. For example, if they don't have a good seal, if it's not the right fit, or if they have facial hair. So those masks can also be uncomfortable to wear. They can make it harder to breathe, and they can contribute to overheating. So again, by far, the steps the public should be taking around the air quality question is to stay inside, ideally in an air-conditioned, recirculated building, but any indoor air is going to be better than being outdoors. If you have to be outdoors, try to avoid intensive exercise. And if you have questions specifically about mask use related to your job or your work, that should be addressed with your employer.
It seems so much better.